Naloxone Directive Procedure. The acronym SAVE ME is used when we respond. The S stands for stimulate. Assess the responsiveness and stimulate using painful and verbal stimuli such as loudly calling their name, sternum rubs, etc. A and V stands for airway and ventilation. If unresponsive, assess the airway, breathing, and circulation.
Doing an ABC check, 5 to 10 seconds.
If there's no pulse, initiate cardiac arrest protocol. If the pulse is present but not breathing, or not breathing normally, a rate under 10 to 12 breaths per minute, initiate rescue breathing with a bag valve mask, BVM, and 100% oxygen at 15 liters per minute. Give one breath every 5 seconds. Insert an oropharyngeal airway, OPA, when feasible. E. Evaluate the situation. If there's no response after rescue breathing for 2 minutes, then administer the first dosage of naloxone.
After 2 minutes of rescue breathing, one breath every 5 to 6 seconds. We're gonna stop, monitor, 5 to 10 seconds. He still has a pulse, he's not breathing.
The M. Medication administration.
Remove Narcan nasal spray from the box. Peel back the tab with the circle to open it. Hold the Narcan nasal spray with your thumb on the bottom of the plunger and your first and middle fingers on either side of the nozzle. Do not press the plunger to test or prime the device. If you do, you will waste all or part of the dose of medication. Tilt the person's head back and provide support under the neck with your hand. Gently insert the tip of the nozzle into one nostril until your fingers on either side of the nozzle are against the person's nose. Press the plunger firmly to give the full dose of Narcan nasal spray. Remove the device from the nostril after giving the dose.
Administer 4 milligrams intranasal using the naloxone. It may take 3 to 8 minutes for the naloxone to take effect. The E, evaluate again. Apply the SpO2 sensor and continue to provide rescue breathing. Repeat the naloxone every 3 to 5 minutes using a new container in the alternating nostril. If no response or breathing less than 10 to 12 breaths per minute, there is no need to wait for previous dose to work before administering a subsequent dose. Continue rescue breaths unless the person is awake and breathing, normally on their own. Check pulse every 60 seconds, and if pulse is absent, initiate cardiac arrest. Check and record vitals when breathing on their own. Continue rescue breathing until respiratory depression has resolved or EMS arrive. Place the person in the recovery position if they regain consciousness or respiratory depression has resolved in order to maintain patented airway and decrease risk of aspiration. There is a high tendency for patients in an overdose state and with withdrawal to vomit, so be aware.
Patient regains consciousness or breathing effectively on his own again, but remains unconscious. Just place him on his side on high flow oxygen at 10 liters per minute.